bringing in 2022 safely. Very, very excited to be here with a group of city leaders who have been working, hold on, I'll take this off. A group of city leaders who've been working incredibly hard to make sure that our preparations will keep public safety, public health, and community building going strong in the next couple days so that we're off to the best possible start for 2022. So I'm here with representatives from many of our agencies who've been working incredibly hard on our plans for first night. And before I begin, I just want to recognize folks, some of whom you will hear from and some of whom are here to support and here to make sure that we're recognizing the work that their employees and all of our city workers have been putting in. So you will hear shortly from Dr. Basola Ojikutu, the director of the Boston Public Health Commission, from Gerard Bailey, Boston Police Superintendent, from Chief Hooley of EMS, Emergency Medical Services, from Chief Kenneth Green of the MBTA Transit Police. I also want to recognize that Chief Shu Benford has been instrumental in this and so many other efforts of our Office of Emergency Management. We have joined here as well Commissioner Brad Garrett from the Boston Transportation Department, Dusty Rhodes, President of Conventures, who has been a partner in this for many, many years, Director Kate Davis from the Mayor's Office of Tourism and Special Events, and Ms. Frederica Williams, President and CEO of Whittier Street Health Center, who is one of our strongest partners as we're really putting public health first this New Year's. First Night began in Boston 46 years ago, and now First Night celebrations happen all over the world. So this is very exciting for me as my first night as mayor of Boston, and at a time when we can ensure that people are coming together to move forward our plans for public safety and public health. As we come together to celebrate community, our joy, and a fresh start in 2022, we must also recognize the moment that we still very much are in. We are in a winter surge driven by the Omicron variant, and we need to take action to protect ourselves, our families, and our communities at large. Welcoming 2022 and gathering to make plans for the new year is an important, healing, joyful ritual and tradition that happens in Boston. And this year, we're making sure that public health leads the way. So today we're announcing some changes to our First Night program. You'll hear from some of our speakers about the details, but by and large, this involves shifting our indoor activities to outdoors and ensuring that we are having vaccinations and boosters right on site. So I'm very, very excited. Thank you so much to all of our partners. You will hear more from Dr. Ojikutu on this, but essentially throughout the day from 12 p.m. to 7 p.m. right at Copley Square near the Bostix booth, people will be able to come and get vaccinated and boosted, even get kids vaccinated. And this is thanks to our partners at Whittier Street. After the fireworks celebration at 7, people will continue to be able to get vaccinated all the way up until 11 p.m. inside the Boston Public Library Central Branch right at Copley, thanks to the Boston Public Health Commission and the hours that our city staff and partners will be putting in. And so this is really important that we want to make sure people who are coming, visiting Boston, coming into the city to enjoy the time with your family and friends, remember that there will be a vaccination and booster clinic right on site, and we hope you take advantage of it. In addition, we have important safety precautions for celebrating the new year, so we'll hear from Chief Hooley and Superintendent Bailey as well. And we want to just remind everyone to pay attention to street closings and parking restrictions to keep our roads clear so that everyone will be safe. Where possible, and I highly encourage anyone from Boston who's coming in, please take the T to the celebrations and please leave your cars at home because we just want to make sure there's as little congestion as possible. So Chief Green will make sure that we are talking about the MBTA's extended services for First Night as well. First Night is an opportunity to share the great cultural and artistic offerings of our city, to celebrate new beginnings. And this year, I am very excited that we're able to bring it back in a way that continues making our city safer, healthier, and more prepared for the new year. Okay, so now I will pass it over to Dr. Basola Ojikutu.
Thank you, Mayor Wu, and thanks everyone for being here. Tomorrow, we will more safely celebrate the New Year together, thanks to the careful planning and precautions that have been implemented by the City of Boston. During our planning for First Night, we have been resolutely focused on protecting Boston residents and every visitor who will be attending the event. The most significant change this year, as Mayor Wu mentioned, is that all City of Boston-sponsored First Night events will be held outdoors. There were a few small events scheduled to be held indoors, but because our citywide positivity rate is currently 9.5%, which is the highest that it has been since testing became widely available during the pandemic, we decided to work very quickly to move these events outdoors. We are rigorously tracking our COVID-19 metrics and will continue to do so to inform our ongoing decision-making. While we encourage everyone to take part in First Night events in person, we do suggest the following precautions. Please don't attend any events if you are feeling at all unwell. If you are experiencing any COVID-19 symptoms, if you've recently been in close contact with someone diagnosed with COVID-19, if you've been directed to self-isolate or quarantine, or if you are awaiting the results of a COVID-19 test. These recommendations apply to all New Year's Eve gatherings. Regarding First Night specifically, if you are unable to participate in person, you can still join the festivities virtually at nbcboston.com. We are also pleased to announce the important addition to First Night events, and that is that we are offering COVID-19 vaccination and boosters to attendees. From 12 noon to 7 p.m. in Copley Square, Whittier Street Health Center will provide an initial dose, a second dose, or a booster to adults or adolescents. Children ages 5 to 11 can also receive a pediatric dose during that time. And we're joined here today by Frederica Williams, President and CEO of Whittier Health Street, who can provide more details. After 7 p.m., vaccines for those 12 and older and booster doses will also be available through Boston EMS and the Boston Public Health Commission. Please note that these are walk-in clinics, so no appointments are necessary. By prioritizing equitable access to vaccines and instituting appropriate prevention measures, we are protecting our residents, keeping our kids in school, preventing hospitals from overflowing, supporting our local businesses, and continuing to build the Boston community. Beyond First Night, the Commission is working closely with city agencies and our state partners to expand access to COVID-19 vaccines and testing, particularly for our most vulnerable populations. Over the coming weeks, more vaccination and testing sites will be made available across the city. New public sites with walk-in availability will be located at City Hall, Madison Park High School, Melnia Cass Recreational Complex, Boston Public Schools, and Fenway Park. Please be aware that we are deeply concerned about the limited availability of testing in many parts of our city. A few additional city-sponsored testing sites will be available in early January. And more details on testing and vaccination will be finalized, and you can read about these on boston.gov. Whether you're attending First Night or celebrating with friends or family elsewhere, it is critical that we all remain vigilant. Therefore, we recommend the following multi-layered prevention strategies. Everyone, even those who are vaccinated, should consider getting a COVID-19 test, if possible, before gathering indoors. We also suggest wearing a well-fitted mask indoors. If you're planning on gathering indoors, please opt for smaller gatherings where you know the vaccination status of the individuals attending. Continue to wash your hands frequently and stay home if you're sick or if you have been exposed to COVID-19, regardless of your vaccination status. Lastly, if you're not vaccinated, get vaccinated and get boosted. Thank you for taking care of yourselves and other Bostonians as we celebrate the promise of a new year.
Next up is Frederica Williams of Whittier Street Health Center.
Good morning. Thank you, Mayor Wu and Dr. Ojukwu, for adding this valuable resource to our festivities on First Night. Our health is our wealth, and so we welcome everybody. Whittier Street Health Center in Roxbury is pleased to be part of this. As we're ringing in the new year and making New Year's resolutions, those who haven't been vaccinated and boosted, we encourage you to walk into the clinic. If for any reason you missed this clinic on First Night on Copley Square, Please visit any one of the public sites, including the Whittier Street Health Center, that has built its capacity to handle up to 500 doses each year. In addition to providing both Pfizer and Moderna vaccinations, our medical director, Dr. Stephen Wright, will be on hand to educate people. We have found that as the infection rates are increasing, as people have questions about the safety and effectiveness of the vaccination, people frequently just walk up and want to have questions answered. So we will have Dr. Wright on hand to educate you about mixing and matching vaccinations. So if you had a Pfizer and you now want to do a Moderna, that's an opportunity. Ask questions about your children, ask questions about the boosters. Our nurses will be on hand. We have a wonderful team that will be there from noon to 7 p.m. We're so grateful to Mayor Wu and to Dr. Ojukutu for putting public health as a priority. This has been a long 2 years, and we thank all of our frontline workers who have sacrificed their lives, including the Whittier team that will be out there providing vaccinations. We take your health seriously. We take your safety seriously, and it is an honor and a privilege to partner with the City of Boston and the state to provide this valuable resource to all of our residents so we can ring in 2022 in good health and safety. Thank you for the opportunity.
Thank you, Ms. Williams. Next, I'll bring up Superintendent Bailey.
Thank you, Mayor Wu. Good morning, everyone. For the first night, Boston 2022, the Boston Police Department, working with our public and private security partners, have come up with a comprehensive safety and security plan to assure a secure, family-friendly environment for all our participants, visitors, and participants alike. The Boston Police Department will have a large police presence around the first night celebrations and on the periphery area of those events. The neighborhoods throughout the city will also have an increase in uniformed police presence. Do's and don'ts for the first night: please do not consume alcohol or smoke marijuana in public. This is a family-friendly event. Please do not fly drones at any of the first night celebrations activities. Please dress accordingly for the expected weather conditions. Please use public transportation. The MBTA is the way to go, as there will be many parking restrictions in effect. Please, if you see something, say something. And we just want to wish everyone a safe and happy New Year. Thank you very much.
Thank you, Superintendent. Next up is Chief Woolley.
Thank you, Mayor. Hey, good morning, everybody. Although we're going to be starting 2022 in the midst of another COVID-19 case surge, I'm optimistic that next new year will be a lot better. Time and time again, when this city's tested, we've proven our strength through coming together, looking out for each other, and doing what is right. On that note, I ask that whatever your plans are for New Year's Eve, you not only look out for your own safety, but also for the well-being of others. Help steer your friends towards responsible decisions. Help ensure that we all get home safely. Be a responsible host. Be a good friend. Be a good wing man, woman, person, whatever you are. If you're out with your buddies, a lot of people are going to celebrate. I get that. Could be home parties, whatever. But there's a lot of unnecessary trips to an emergency room that can be avoided by just some common sense. Many of the calls that we respond to are on New Year's Eve could be avoided. I'm proud of the men and women of Boston EMS. They've been on the front lines of this pandemic for 2 years now, caring for nearly 6,000 confirmed COVID-positive residents of Boston. They continue to do their job with professionalism and clinical excellence, and we will be deploying additional personnel, both at dispatch operations and in ambulances, to ensure the residents across the city have access to our services should they experience a medical emergency. Because as everyone's pointing out, this is a citywide event. It's not just Copley, downtown, the waterfront. There's gatherings all across the city, and we know that. That said, as great as our personnel are and as prepared as they will be for the additional demand, I encourage you to take every action to not require our services. Be safe, celebrate responsibly, and be a good friend and neighbor. Thank you all, and from everybody at Boston EMS, Happy New Year.
Thank you, Chief Hooley. Next up, Chief Green.
Thank you, Mayor Wu. Good morning. I want to remind everyone that the first night celebration is a family-oriented event, so we encourage families to utilize the MBTA transportation system to come into the city of Boston and enjoy the festivities. The MBTA will run on a Saturday schedule, but will increase service after 3 p.m. Also, fares will not be collected starting 8 p.m. MBTA riders are reminded that federal and state regulations continue to ensure face coverings continue to require face coverings while riding the MBTA vehicles and within the MBTA system, regardless of a person's vaccination status. Those who refuse to comply may be denied boarding or be removed from MBTA vehicles and the system. For further information in regards to service on the MBTA during first night, please access our website at mbta.com. Regarding public safety, Transit Police will have additional officers assigned to the MBTA core system to ensure safe and efficient travel be had by all. We ask our riders to act responsibly and be respectful to one another. Additionally, please be mindful of young children, the elderly, and persons with disabilities while utilizing the MBTA. The consumption of alcohol and/or unruly behavior, as always, will not be tolerated. Currently, there is no known credible threat to this event or regarding the MBTA. However, we will continue to be in close contact with our local, state, and federal law enforcement partners throughout the night. As always, we ask the public's help. If you see something, please say something. Be our extra set of eyes and ears, our force multiplier, if you will. And know this, that you, the public, are the best resource that law enforcement has. So together, working together, we can ensure that we all have a safe and enjoyable first night.
Thank you, Chief. Fare-free MBTA after 8 p.m. We love to see it. Dusty, do you want to add anything? Okay, good. Okay, I think that's it for speaking program questions.
A lot of people are relying on testing to enjoy the holidays, and I wonder, you mentioned extended testing, I wonder if you can talk about that expansion and what people should be doing, because they may decide not to go to first night because they realize it's impossible to get a test.
Yeah, I'll pass this over to Dr. Ojikutu, but note first and give such tremendous thanks for the incredible effort leading up to the holidays, where the City of Boston distributed hundreds of thousands of tests to residents through our library system, through our community centers, through the Boston Housing Authority, through the Boston Public Schools. We have just received word from the state as well that teachers will also have tests available to ensure that everyone can come back to school safe and tested. We also saw very, very long lines, right? We saw a tremendous, tremendous demand for testing that has been impossible to keep up with all the way from the city's perspective alone. So we're continuing to work with partners at the state and federal level to address some of those shortages, as well as stand up our more permanent ongoing testing sites. Dr. Ojikutu?
So I'll just add that our plan is to add 3 additional standing testing sites by early to mid-January. We're moving as fast as we can to do that. We realize that there is a shortage. This isn't just a shortage in Boston. It's a shortage statewide, and it's a shortage nationally. We are working with our state partners, and as soon as we're able to access more rapid tests from them, we will order as many as we can get our hands on and distribute them in a way that we think is, equitable across the city, which I think is what we were trying to accomplish. And I believe we did accomplish that with the last amount that we were offered. I'd also like to give Frederica Williams a chance to speak. They will be doing some distribution on first night.
Thank you, Dr. Ojikutu. Fortunately, on my way here, we received a delivery from the state, and we'll be distributing rapid tests at the event. In addition, through a federal and also through the state, a lot of community health centers, including the Whittier Street Health Center, will have distribution of rapid kits. So what we wanted to do, in addition to getting your vaccination and your boosters, we will be giving out rapid kits to people who present, and for those who miss the event, they can come to us or go to another community health center. We're also expanding our PCR fixed-based testing site. The team at Whittier has been testing since March of 2020, and we were sad to ask them, and of course they stepped up because we're seeing the infection rates increasing, we're seeing the illnesses. So again, I just want to stress that the vaccines are safe, they're effective, they're saving lives, and they're preventing illnesses. So please get vaccinated and boosted, and we'll give you a rapid kit. Thank you.
And I want to note because, again, I hear so many of the experiences of our residents who had been hoping to get a kit and were standing in line and the supplies ran out. So we hear you and really I'm so sorry that the supplies haven't been able to keep up as much as what we need right now. We're working as hard as we can at the city level, but for folks who are needing access to these kits, we really just are grateful for your patience. Yes.
Will be able to get multiple, because it seems like one of the problems is people are testing, a couple times a week. So when they pick up the test, say at first night, can you get a couple boxes? Is there a limit?
Okay. Go ahead.
That is the plan. So we'll bring 1,000 so that people have multiple kits, and we will give them out until we run out of the supplies. And again, if we run out, they're the locations that people could go to get rapid kits. So our goal is to bring 1,000 kits to the event. Thank you.
And we ask people to, take up to one for each family member, but take only what you need for this round because there are many, many folks who have no access, and even if they are available for purchase, we want to make sure that there's equity in how these are distributed. And so really just ask folks to be mindful of the need and the need across the entire community. Karen?
Should get a test. I mean, I talked to a lot of people online yesterday where they hadn't gone out, they just gone and stuff. I mean, you could just get a test when you can.
So there are many reasons to be tested. Certainly, if you're having symptoms of COVID-19, particularly upper respiratory tract infection sort of symptoms, you should be tested. If you have been exposed and you're aware of that exposure, you should be tested. If you are going to a gathering and you want to protect the other people at the gathering, we're suggesting that people be tested. The way that we are suggesting doing that testing is over the course of a few days. So in fact, if you have two tests inside one test kit, then you could take one of those a bit more than 24 hours before your event, and then immediately prior to your event, like within an hour or so, you can take the second test kit, and you can take the second test, and that will increase the sensitivity of the test, so you'll know if you're positive or not. So those are the reasons. I think that as long as our supply is available, I would encourage people to test in any event that they're concerned, so that we can diminish the spread.
When supplies are this tight, people, if you're, say, a force capital, you're a whole should you get a test because you happen to be in a place where one is available, or should you maybe save that for someone who may be going to a party or going back to school to teach or something along those lines?
Certainly there are higher priority reasons to be tested, and I agree with you. If you're going to attend an event and there's any concern or you want to protect the other people at the event, you should be testing prior to that event. And if you have symptoms, as I said, you should be tested. Certainly we're in a situation of scarcity right now, so we want to be careful about that, but we also want to make this particular mitigation strategy as available to people as possible. The supply is going to increase. We've heard that from the federal level. We've heard that from the state. Right now, things are tight, but we are hoping to increase the supply over time so that people can have that more available.
They didn't have any symptoms and weren't endangering anybody. I mean, that's why I asked that.
Sure, of course not. Of course not, I understand.
Well, maybe I'll back up a little bit and just do because I see some folks maybe just for the first part of the news and then testing in particular. Hoy estamos compartiendo unas noticias sobre las preparaciones para la celebración First Night, la primera noche en Boston, para celebrar el Año Nuevo. Estamos importantes en este momento de los casos aumentando, de priorizar la salud pública y también la disponibilidad de testing. Entonces, en la celebración estamos compartiendo la oportunidad de obtener un primera dosis de vacuna, segunda dosis, dosis pediátrico o también boosters. El clínico va a ser en Copley Square a la mediodía, a las 7 y después adentro de la biblioteca en Copley Central Library hasta el 11. Entonces es una oportunidad no solamente celebrar y estar con la familia, con la comunidad, pero también obtener una más importante protección en vacunación para cada miembro de nuestra comunidad. En particular, como sabemos, hay una disparidad en la posibilidad de obtener testing en cada barrio de Boston. Entonces, la Comisión de Salud Pública en Boston estamos trabajando muy duro para proveer acceso con 3 nuevos lugares en enero para testing y también en la celebración Whittier Street Health Center va a proveer acceso al testing kits también. ¿Una pregunta más específica?
So I'm not going to attempt to speak in Spanish like Mayor Wu. So in addition to making the tests available at this event, we also have a lot of partnership with the Latinx community, Alianza Hispana. We're working with the Lawyers for Civil Rights, taking our mobile health team, are going to locations. 45% of our patients are Spanish speaking, so our staff reflect that population. So the diversity is there, whether it's Haitian, Creole, Spanish. So wherever the mobile team is going, we're going to public housing developments, we're going to several of the schools, we're going to street corners, we're going to mass and cast, meeting people where they are, because it's wonderful. It's important to work with trusted partners so that when the mobile vans are there, they can ask questions and engage people in care. So we're meeting people where they are, but working with our trusted Latinx partners.
Sí, otra vez y otra vez, la vacuna salva vidas y estoy muy agradecida a todos los miembros de la comunidad para proteger no solamente usted y su familia, pero también la comunidad en general. Yes.
Slightly different topic, but we got a tip that the Boston Police Union and the city had agreed to sit down next week to talk a little bit about the vaccination requirements. I was just curious if you wanted to comment on that or what the scope of the negotiations were.
Oh, sure. So this is in regards to the updated requirements for vaccination for the city workforce and to ensure that the nearly 90% of city workers who are vaccinated, that we grow that rate to ensure everyone is vaccinated to keep all of our workforce safe, to keep the public safe. Because our city workforce has multiple unions and collective bargaining units, that kicks off a process in which we will be engaging with each union to really go through the impacts and talk through what this means. We have already started having weekly drop-in information sessions for any and all department heads and engaging with departments one by one to ensure that we are not only helping to increase the vaccination rates, but also make it available for people to get boosted who already are vaccinated as well. Do you want to add anything? No. Okay, good. Yes.
So to help minimize the spread, the indoor events for first night have been moved outside, but with encouraging people to take the tea, are you concerned about large crowds of people packed inside trains that could potentially cause some spreading?
Sure. And then I'll kick it to you.
So certainly, we're always concerned in trying to mitigate the risk of transmission on transportation, and we encourage people. First and foremost, we should be vaccinated and we should be boosted. But secondly, in regards to using our public transportation, we should be wearing well-fitting, snugly fitting masks. And these are masks that aren't single layer. We're not talking about simple single layer cotton masks. We're talking about double or triple layer masks. This is what we should do as a mitigation strategy on our, whether it be on trains or when we're traveling and on airplanes. So these are important strategies to consider, but we still want people to use our public transportation.
So as I said earlier, state and federal regulations require everybody to wear masks. So we're hoping that people heed to our request. If it's not for themselves, it's for their fellow riders. Yeah, so we'll be out there, we'll ensure, and like I said earlier, if people aren't wearing masks, then, we will at certain stations supply masks for them, or we will ask them to leave our station.
And I just want to emphasize that I have been on the T. I ride the T to work very frequently. I've been on the T every single week since taking office and have had a great experience with fellow passengers there, although no one talks to me, but it's okay. What we know is that with the increased frequency that the trains will be running, thank you very much to the MBTA, that if someone doesn't feel comfortable, if a train car is looking like it's already full or getting crowded, you can wait for the next one because they will be coming more frequently. And I think removing the barriers for payment and for fares also just ensures that people can not feel like they're worrying about having one more barrier to do so. So we encourage people to, of course, be aware, keep your masks on, but the T is safe, and I'm happy to count myself among the passengers who use it regularly. No necesita prueba todavía en esa celebración porque los policías nuevas en Boston comienza el 15 de enero en general, pero también el requisito para la prueba va a aplicar solamente a actividades adentro de edificios, porque cuando es afuera el riesgo de transmisión es más abajo, entonces es una situación para las familias de estar con la comunidad, pero afuera con el espacio para la distancia y otros mecanismos para proteger todos los miembros de la comunidad.
Did you lose any first night acts or activities because you needed to move them outdoors or had to take precautions? Did you
moved a number of acts outdoors in observance of taking total precaution, so there are no indoor events.
But did anyone drop out or?
No one dropped out, and we were able to accommodate them by increasing by a half hour and adding a stage. So it's all working out well, and no one's being left out.
Good. Everyone good? Anyone in the back?
I don't know if you could just add, there's a lot of stress.
Yes.
How do we celebrate? How do we have a Happy New Year thinking about testing and vaccinating? I mean, it's just a difficult time.
It's a very difficult time, and we're seeing that across every connection point to our residents, whether it is the increased need for mental health supports within our school system or with our seniors, or as some of the calls, crisis calls coming in to the Boston Police and first responders reflect an intensity of need for mental health supports. So, and in my part, I know in my family we have traditions that we celebrate every year that still feel different now and still feel different for the second year in a row in terms of the holiday season, and it just feels like this is going on and on and on. I really want to emphasize that even though there are many things now that remind us of where we were a year ago with the beginning of a winter surge, with the call for everyone to be careful and safe, we are in a very different place right now. We are in a much more hopeful and empowered place because vaccinations are widely available to everyone, because we are seeing more and more increase in the supply and availability of testing. And so those tools are within our reach right now. We just have to make sure we are staying, I know I can hear Dr. Ojukutu, hopeful but vigilant, not alarmed, hopeful but vigilant in making sure that we're enjoying each other in a safe way, being together with public health as an extra consideration. And the burden really shouldn't be on residents to feel like you're not doing the right thing, or you're being, discouraged, or you're not supposed to have any fun or not celebrate. This is a joyful time for the city, and that's why city government, from the Boston Public Health Commission, all of our public safety and first responders, agencies, our arts and tourism and special events agencies, we are all here to work as hard as we possibly can to make these celebrations safe. And so the reality is that we are not out of this pandemic, and we won't be out of this pandemic tomorrow or next week or next month. We need to continue taking precautions, but as we learn to live with the pandemic and reduce the risk of activities, we're not headed back for another replay of the worst that we've gone through. I think in the next couple weeks, I'm going to spend some time going to visit some of our hospitals and community health centers just to check in and say thank you to our first responder and essential workers in our healthcare workforce. Many of our workers across the city, essential workers, have been at this for nearly 2 years. They're exhausted. They're seeing hospitalizations continue to creep up. We are hearing tremendous stress from those who have been at the front lines, even more intensely than those of us who've had the privilege and the luxury of working remotely in some ways. And so, for their sake, for our workers who have no choice but to be saving lives at the front lines every single day, we all need to step up and make sure we're taking care of each other. The vast majority of people who are being hospitalized right now are not vaccinated. When you are vaccinated, yes, there's still a chance you can get COVID, but the symptoms are much less serious, and you are much less likely to pass it on to someone else or to need to go to the hospital yourself. And so when we're talking about our city workforce, when we're talking about employees and patrons at restaurants and gyms and entertainment venues, this is really about how we take a big step forward in moving towards that light at the end of the tunnel. Every time that someone is a City of Boston employee who is not vaccinated, and people have various reasons for not feeling comfortable and not wanting to do that, right? Although we are, again, 90% vaccinated at the City of Boston. But for every person who is not vaccinated, who needs then to go to the hospital because they've contracted COVID, who is drawing on the resources of our healthcare system, of our health insurance system, of taxpayer dollars, this is something that we need to start taking action towards. And so every one of us is connected to everyone else in our communities, and it's a moment of celebration to realize not how bleak it can feel stressful, but actually how empowered we are to make a difference not only for ourselves, but for every single person we care about, who we might not even know, but we're sitting next to on the T or working next to in our offices or coming in to interact with across the city. You can do something to keep everyone in our community safe, and that is to get vaccinated, get boosted, and make sure your whole family is doing the same. Okay, great. Thank you, everyone.